Hi, I'm Brian Hurley, an addiction physician based in Los Angeles. I'm the immediate past president of the American Society of Addiction Medicine, and I'm also a member of the Motivational Interviewing Network of Trainers. I'm going to break down how to conduct effective motivational interviewing conversations by evoking change talk and using OARS skills. OARS stands for open-ended questions, affirmations, reflections, and summaries, and cover how to give information and advice during clinical interviews so you can begin to incorporate motivational interviewing into practice. I'll start with change talk. Change talk is speech that favors movement in the direction of positive change. Somebody saying something like, I'm looking at non-opioids for pain, or these pain medications are really making me tired, right? It really promotes maybe somebody considering less risky alternatives. And it's specific to a particular change target. That target could be drinking. That target could be tobacco use, right? It doesn't have to be pain medications. And sustained talk would be the opposite. Examples like, I could never imagine my life without these pills, or please don't ever make any changes to my opioid regimen. That would be sustained talk, the opposite of change. And one way to have a conversation that evokes change talk is to start with an open-ended question. Questions like, tell me more around your experience with pain. What have you found helpful? What hasn't been helpful? Broad, open-ended questions. Affirmations can be simple and complex. Reflections are the most common used technique in motivational interviewing. The idea is we're doing more reflections than questions or other types of interactions. Reflections are where we state back to somebody what they said to us. And they can be simple, where we literally just parrot back exactly what they said, or they can be complex, where we listen for what are the ideas, the goals, the values underneath what somebody said, and what can we then try to elevate to advance the conversation. Summaries are simply a way of pulling together what we heard somebody say, create a summary, and then that can help advance the conversation. And as clinicians, we oftentimes have information we want to share, and we can share that in a motivational interviewing adherent way through informing and advising. So, OARS, open-ended questions, affirmations, reflections, summaries with informing and advising. Open-ended questions, I already kind of covered it, but it's questions that really can't be answered by a yes, no, or a one-word response. Open-ended questions can include things like, tell me more about your pain. What has been helpful? What hasn't been helpful? Tell me more about your use of other substances. What do you think would be helpful? Those are all open-ended questions, and it really helps you understand the person's perspective. The downside to these questions is if you just keep asking questions, it begins to feel like an interrogation. And a good motivational interview is actually more of a dance, where they make a statement and you make a statement in response. So one of the statements that you can make is an affirmation. And there are simple and complex affirmations. A simple affirmation is simply an appreciative statement where you say, I really appreciate the effort you made there, or you did really well at following up on whatever the recommendation was. Those are all simple affirmations. Complex affirmations listen kind of, what is an enduring positive attribute? So if somebody's yelling at me, like, please don't take away my pain medications, this is really important to me, I might say, you aren't afraid to speak up and make yourself understood. Like you're saying, I recognize, you tell it like it is. This is important to you. If somebody shows up, even if they show up late, I might say something like, it's important to you to follow up on your commitments. It's speaking to something underneath somebody's capabilities. And those affirmations can be really validating. We'll spend a little bit more time on reflections because they're such an important part of motivational interviewing. A simple reflection is where you literally just repeat back what somebody told you. If somebody says, opioids are the only thing that works, I might say, opioids are the only thing that works. It's literally just parroting back what somebody says. And if you don't know what to say, if you're kind of stuck, a simple reflection can be helpful at the very least, just inviting the person to elaborate because they now know you've heard what they said. But when you actually are grounded in where you're going in a conversation, the best way to move the conversation is through a complex reflection where you might paraphrase. Somebody might say something to me like, gosh, these opioids are really helpful, but I don't like the side effects. And you might say, you're looking for something that doesn't have side effects. Now, they didn't say they were looking for something. They just mentioned that there were side effects, but I'm paraphrasing. I'm now moving the direction. It's a reflection. It's not a question, but I'm making a statement that moves the direction of the conversation towards positive change. I might continue the paragraph. So if somebody says, I am just at my wit's end. I don't know what to do about my pain anymore. You might say, what you have right now isn't working. Let's figure out something that does. That's a statement and it continues the paragraph. If somebody says, I'm so scared of what it might be like if I didn't have access to these meds, you might say, you're really scared. It's only a small statement, but it's a complex reflection. Or you might use an analogy and metaphor. Somebody says, I go to see all these doctors and there just isn't any progress. You might say, gosh, you're doing all this work and you're just treading water. That would be like a metaphor. You can use an overstatement or an understatement as a way of evoking change talk. One example of this is somebody says, yeah, I've been taking opioid medications for a long time and they work really well for me. I might say something like, oh, you like absolutely everything about the meds you're on. And that might invite them to elaborate. Well, no. I've been on them and they work, but there's things I don't like about them. Okay, got it. I'm now using an overstatement to evoke what they might be ambivalent about. And you can use a double-sided reflection. Like on one hand, you can't imagine your life without opioids, but on the other hand, you can't imagine living this way forever. That would be reflecting sustained talk on one hand and change talk on the other. One metaphor you can think of is during a conversation with a patient, what they say is like the tip of an iceberg, right? And that's what you can provide a simple reflection, just reflecting the tip of that iceberg. But underneath that are ideas, values, fears, hopes, plans. And if we listen for what might be underneath that and make hypotheses through complex reflections, we can really then move the conversation in a way that's adherent with somebody's ideas and values and intentions, because we're listening for that and amplifying it using complex reflections. So as an example, if somebody says to me, right now the pain meds don't really help me feel better the way they used to. In fact, I feel worse now. You might say, opioids make you feel worse now. There's not that much movement in that. It's just a simple reflection. Or a more complex reflection would be, so you find that your pain treatment is no longer helping you feel better the way it used to. Again, more of a restatement. You could also use a double-sided reflection. In the past, these meds helped. Now they make things worse. Or you can also continue the paragraph. So in the past, these meds help you feel better. Now they make things worse. And you want to find some way to feel better that isn't simply taking this medication, right? And that then invites the person to elaborate on a whole set of, topics around what they might consider that could be helpful. A summarizing statement is a particular form of reflection. It's like picking a bouquet. What came up during the conversation that I then want to put in a bouquet and present back to somebody? And it reassures that I've heard them and really helps move the conversation along. As an example of a summarizing statement, I might say, well, opioids relax you and help take the edge off, but you want to revisit using them because they interfere with your job and they create a lot of anxiety when you go to the pharmacy, right? You're sort of understanding the reasons why somebody might be attached to a certain behavior, but then also emphasize some of the reasons why they might want to change. And we have information and advice that we like to give. A way to do that, adherent with motivational interviewing, is to ask permission, right? I have some ideas. Is it okay if I share my ideas? You might say, what do you already know about pain treatments and alternatives to opioids? Then you might give a limited amount of information in clear language and then say, so what do you think? What do you think of what I said? And what might you be ready to do? Motivational interviewing doesn't always end with a plan. It doesn't always end with a commitment to exactly what somebody's going to do. Many times these conversations are just the planting seeds. People are oftentimes ambivalent, and confronting somebody consistently is generally ineffective. So exploring what somebody already knows, then offering your own expertise can be a really effective way of helping set the stage for future change. Thank you for watching, and be sure to check out other videos on motivational interviewing.